The intention of this presentation is to inform students and patients about the anterior cruciate ligament. Some objectives include discussing the anatomy of the ACL, risk factors associated with ruptures, how ACL tears are diagnosed, what surgery and rehabilitation entails, and some potential long-term consequences associated with ACL ruptures and reconstructions.
What is the anatomy of the ACL?
The ACL is a ligament that originates from the posteromedial aspect of the lateral femoral condyle and courses anteriorly, medially, and distally across the knee joint where it inserts onto the anterior intercondylar fossa of the tibia. Its role in stabilizing the knee is prevention of hyperextension, anterior tibial translation, and rotary movement. Specialized mechanoreceptors, including Ruffini corpuscles, Pacinian corpuscles, Golgi-like tendon receptors, and nocioreceptors, provide proprioceptive feedback to the central nervous system via the posterior articular branches of the tibial nerve. Blood is mainly provided by the middle genicular artery, and the primary composition of the ACL is type 1 and type 3 collagenous fibers. Competitive athletes engaging in sports which require abrupt changes in direction, contact field sports, and sports which require copious amounts of jumping and landing. Approximately 70 to 80% of all ACL injuries are non-contact by nature. To understand the etiology of ACL injuries, researchers have been able to categorize potential risk factors into two main areas: internal risk factors and external risk factors. Some internal risk factors include previous lower extremity injuries, genetic predisposition, gender, being women are more predisposed, hormonal status at the time of injury, an increase in body mass index, neuromuscular deficits, biomechanical abnormalities, anatomical malalignments, and unique anatomical influences. Some extrinsic risk factors include surface conditions, weather conditions, footwear, and level of competition.
So how will I know if I tore my ACL?
Symptoms include a loud pop at the initial time of injury, followed by severe pain and an inability to continue activity, rapid swelling, a decrease in range of motion of both knee flexion and extension, and difficulty with bearing weight. During physical examinations, sports medicine doctors and orthopedic surgeons can diagnose ACL ruptures by utilizing the Lachman test, the pivot shift test, the drawer test, and utilization of MRIs and X-rays to confirm the diagnosis.
What should I expect regarding to experiencing surgery?
ACL reconstruction are outpatient procedures, usually performed under general anesthesia and typically take less than 2 hours to perform. First, 2 keyhole incisions are made to allow access for an arthroscope, which is a tool surgeons utilize to see the inside of a joint. Next is the removal of the ruptured ligament and any other components, such as menisci, that might be damaged. Depending on the orthopedic surgeon's decision, either the harvesting of an autograft is performed or an allograft is used to replace the torn ligament. Typically, there are 3 types of autografts used: bone patellar tendon bone autografts, hamstring tendon autografts, usually consisting of the semitendinosus and gracilis, and bone quadriceps tendon autografts. After the harvesting of the autografts, tunnels are precisely drilled into the femoral condyle and tibial plateau, and the new graft is pulled and placed within the tunnel and is anchored to the bones with screws.
What can I expect regarding rehabilitation?
Following reconstructive surgery, the rehabilitation process can be painful, arduous, and psychologically demanding. Most rehab protocols are broken into 5 or 6 stages. The first stage is the acute phase, which usually lasts for 2 to 4 weeks. The goals of the acute phase are to increase tolerance to bearing weight, to reduce pain and inflammation, which are usually accomplished with opioid and anti-inflammatory prescriptions and the use of cryotherapy, to improve knee flexion and knee extension ranges of motion by utilizing both active and passive movements, such as heel props and heel slides, and quadriceps femoris activation, which is accomplished by utilizing isometrics and exercises like the straight leg raise. Depending on the protocol, Phase 2 usually lasts for 4 to 8 weeks. The goals include reducing all inflammation, full weight bearing with normalized gait, improving knee flexion to 120 degrees or greater, and maintaining full knee extension. Typically, closed chain exercises like step-ups and partial squats are added to most protocols in addition to isolated hip strengthening exercises like prone bridges, clamshells, and resisted hip flexion. Balance exercises are usually introduced to help restore any proprioceptive deficits that the surgery may have induced. The third phase is the strengthening phase, which can last for 8 to 16 weeks depending on the protocol and the individual's progression. The goals are to eliminate all swelling, perform all activities of daily living, obtain a range of motion of knee flexion equivalent to the unaffected leg, continue to improve balance with progressively challenging tasks and environments, and continue to increase lower extremity strength with properly progressed resistance exercises. Exercises utilizing equipment like the seated leg curl and leg press can be introduced. However, it is recommended to avoid open chain resisted knee extension due to the weakness of the graft at this point in the rehabilitation. It's also recommended to improve the endurance of the lower extremity musculature by incorporating activities like swimming, cycling, walking, rowing, and the use of elliptical machines. The fourth stage of most rehab protocols is the strength, agility, and plyometric phase. The goals of this stage are to enhance dynamic stability and prepare the individual for the demands of their sport, obtain a 90% or greater strength symmetry of both the quadriceps and hamstrings, obtain 90% or greater symmetry with single leg hop tests, and incorporate acceleration and deceleration variations in running, turning, and cutting maneuvers to improve orthokinetic reflexes to prevent new trauma during competition.
When is the best time to return to a sport or any physical activity?
The fifth stage is the return to sport phase. In order for individuals to return to their sport, certain criteria should be met. There should be no evidence of pain or swelling. Individuals should obtain 90% or greater symmetry of strength, and individuals should pass a psychological readiness evaluation. During the initial return to sport, the inclusion of protective measures like taping and bracing may provide additional support for the knee. Most importantly, gradual progression. Athletes should gradually increase their training intensity and volume to allow their knees to adapt to the demands of their sport.
What are the long-term consequences to a ruptured ACL?
Patients with ACL injuries have a high risk of developing post-traumatic osteoarthritis. Structural factors like damage to menisci, biological factors like inflammatory cytokines, neuromuscular factors like the loss of mechanoreceptors within the ACL, and mechanical factors like joint derangement are all theorized to be involved in the degradation process. A number of other factors may mediate the risk of post-traumatic osteoarthritis, including gender, age, high BMIs, obesity, physical activity level, smoking, subsequent injury, and the interval between the initial injury and the surgery. If there are no further questions, I would like to provide a synopsis of the material covered. First, we provided an overview of the anatomy of the ACL. Second, we discussed risk factors associated with individuals who are prone to ACL ruptures. Third, we discussed symptoms and the methods used to diagnose ACL tears. Fourth, we provided a detailed description of what the reconstructive surgery entails. Fifth, we discussed what the rehabilitation process typically is. And last, we covered the long-term issues associated with ACL ruptures. Hopefully, this detailed analysis, along with the provided visual aids, will assist you in the rehabilitation process of individuals who are dealt with this unfortunate traumatic injury.